Everybody. My name is Adam, he, him, his pronouns. I am currently a practicum clinician at CLU CAPS. And also getting my graduate degree from Pepperdine University Graduate School of Education and Psychology. Nice to meet you.
Perfect. My name is Michael. I use he, him, his pronouns. I'm another practicum clinician over at CLU CAPS, currently studying in California Lutheran University's PsyD program down over in Oxnard. So with that in mind, now that you guys know us, I just wanted to jump right into the first question, which a lot of international students have, is will CAPS respect my unique culture, beliefs, and faith?
Yeah, absolutely. CAPS clinicians here prioritize cultural sensitivity, and we respect students from all walks of life and all backgrounds. Therapists here at CAPS understand that culture plays a huge and significant role in identity, mental health, and how challenges are navigated across the lifespan. We strive to create a safe and inclusive space where students feel heard, valued, supported, and we integrate multicultural perspectives into our approach, adapting therapy to each student's unique experiences and values. Lastly, we recognize that international students may face additional stressors, such as adjusting to a new country, language barriers, immigration concerns, and we work collaboratively to address these challenges with our students.
Absolutely. And just some key points to highlight there is that we do our best to respect all cultures, faiths, and beliefs in all of our practices. And we oftentimes see patients coming in that feel as if they're struggling to manage the seeming incompatibilities between their own culture and their own background and this new culture that they find themselves in. And we do a lot of good work where we can help people navigate those intricacies. So, Adam, another question that's often asked of us CAPS clinicians is what kind of work do we do here at CAPS, and what sort of services and specialties do we CAPS clinicians provide and specialize in?
Sure, yeah. CAPS clinicians come from diverse training backgrounds and offer a range of therapeutic approaches. Services include individual therapy, group therapy, workshops, crisis support, all tailored to meet the need of our student population. For example, I work from an integrative perspective. I draw from a humanistic, client-driven, and relational orientation, as well as also utilizing skills-based approaches to help students with emotion regulation, interpersonal relationships, and self-exploration, thus both supporting short-term challenges while also cultivating long-term growth. Other clinicians here specialize in areas such as trauma-informed care, cognitive behavioral therapy, mindfulness-based approaches, and many more.
Perfect. And as for myself, I'm an ACT-focused clinician, which really focuses on this idea of acceptance and commitment, wherein we're trying to find these things that are outside of our control, which we can practice accepting. At the same time, finding those things that we can control so we can commit ourselves to living a life in line with the things that we care about, our values. So finally, Adam, another question that's often asked of a lot of international students is what happens if I can't come into CAPS for session, or if I don't feel like I have the time to make it over to that corner of campus?
Yeah, here at CAPS, we respect everyone's time and we try to do the best to support our students with wherever they're at. Services include telehealth options, so students can receive remote services over telehealth platforms such as Zoom if they're unable to attend in person, as long as they're in the state of California at that time. We also offer for CalLU students free 24/7 virtual mental health through Timely Care, which offers both short-term counseling as well as wellness coaching. Additionally, another resource that we encourage students to use is if they're in distress, then we offer 988 Suicide and Crisis Lifeline, which is immediate support for anyone in distress, and it's also available 24/7. And lastly, we encourage our students to get involved with the resources available to them as students here at CalLU. So that includes student support groups, faculty staff mentorship, self-care and peer support, as well as local mental health providers, which CAPS clinicians can absolutely get you all referred to should you need.
All right, perfect. Well, thank you very much for taking the time, Adam. This is a great way, I think, to answer some of those questions. And most importantly, hopefully for those international students listening, you have become a bit more familiar with the services provided by CAPS or Counseling Psychological Services at CLU. And hopefully we'll see you soon to help you manage your mental health needs.